I am Lucinda, and this is How I Ally. All right. Hello and welcome to How I Ally. I have a very, very important, esteemed guest this week, Amani Echols. She is I am going to have you introduce yourself if that's all right.
Absolutely. Yeah, thank you so much for having me here today. I'm really excited to have this conversation with you. My name is Amani Echols, and I am the Senior Policy Analyst for Maternal Health at the National Partnership for Women and Families, where our overarching mission is to improve the lives of women and families by achieving equity for all. And our sweet spot is really to work at the nexus of achieving equity, economic justice, and health justice. So we work intensely in those core topic areas, but also at the intersection of them as well.
Wow, that is such heavy but heavily
Mhm.
important um, subject matter and work. So last week was
Black Maternal Health Week. Yeah.
I
Yeah,
like
it was
that.
actually the 10th anniversary of the week, which is pretty exciting. And
Wow.
the theme of the week, so for one, it happens each year between April 11th and the 17th, and it is hosted and led by Black Mamas Matter Alliance, which is a core partner that we work with often to do our work at the National Partnership. But the theme for this 10th anniversary of Black Maternal Health Week was justice and joy. And so at the National Partnership, we really wanted to lean into that theme because we know that every day Black moms are meeting the challenges of raising their children, providing and supporting their families to thrive in a system that was really never set up for them to be able to thrive. The system is set up so they can't, or to make it really, really hard. So yeah, I can see your face. You know what I'm talking about. But even while battling racism in all of its forms, and often doing the care work and that is often overlooked and taken for granted, Black moms are still claiming joy and working in pursuit of justice, and that is really what the theme was all about.
That is so beautiful to hold both of those things at once.
Mhm.
Joy and a very not particularly joyful fight,
Yes.
but to find joy as a mom in not the best circumstances is
Mhm.
something that is really hard to do.
A beautiful quote from Angela Davis that I would actually like to read that really summarizes the theme of justice and joy, which is the most radical thing a mother can do is raise her children with love in a world that tries to deny their humanity. And I feel like that quote sums up justice and joy beautifully. And Black women, Black moms are more than just what they carry and what they overcome. They are truly showing up for their families every single day. And that is what we at the National Partnership want to fight for, and to ensure that all pregnant people, especially Black women who we know are bearing the brunt of the maternal health crisis in the United States, have the ability to freely choose. And if they want to become pregnant, and if they choose to, being able to do so where they have agency over how they give birth, who they give birth with, and where, and that they have healthy outcomes. They can go home healthy with a healthy baby and really be able to look at their pregnancy and childbirth experience from a place of joy. That is what all moms hope to experience.
Yes, that's the image that I feel like we're all sold at some point, maybe that
Mhm.
you're there and, like, you have family and they have balloons or something, like, in the waiting room, and it's so often is nothing like that.
Yeah, and as you said that, I can picture that because that is often what you're seeing in movies, or the retelling in stories and books. And that is awesome. Like that is true for many folks. But I do think it is a misconception that pregnancy and childbirth is this universally happy experience. Though that is the outcome for some, the reality is that pregnancy and childbirth is inherently risky, and it's riskier in the United States compared to other high income countries. And within the United States, it's especially risky for Black women. That is why Black Maternal Health Week exists, which is that the United States, compared to other high income countries, even with a slight decrease in maternal mortality after the COVID-19 pandemic, still fares worse in maternal health outcomes compared to other high income countries. The majority of these deaths do take place in the postpartum period, or what some folks like to call the fourth trimester. Um, and for every maternal death, there's even more near miss cases, or what folks also call severe maternal morbidity, where moms are experiencing pregnancy complications that they survive, but then have all of these repercussions or follow-up healthcare needs during pregnancy and after childbirth. But most of these deaths are preventable. The latest CDC data shows that nearly 90%, which that percentage is really mind-blowing, that 90% of these deaths are preventable, especially in a society where we are paying so much for healthcare, and it's really not translating into the healthy birth outcomes that we'd like to see and the positive birth experience that all moms hope to have. And so there are several reasons for why that is, but two that I would like to highlight at the top of this conversation is one, really the devaluing and disregard for Black women's humanity, like in society and within the medical system. And then two, the fact that OBGYNs and the medical model of care is what is prioritized in the United States, which is different from our peer high income countries where midwifery model of care is leading the path, and many, many more births are attended by midwives in other countries than they are in the US. To backtrack a little bit, so the one beautiful thing about midwifery care is that time and time again, the the birth outcomes from those that have their birth attended by a midwife are either equal or better than the birth outcomes of those attended by physicians, or predominantly having care provided by a physician. And we see that on many fronts, including higher rates of spontaneous vaginal births, lower costs, less intervention, higher rates of breastfeeding, greater satisfaction of care, all experienced by those who are able to have their births attended by a midwife. And so you would think with lower costs, better birth outcomes, and higher satisfaction that it would be a no-brainer. It's a win-win-win for society. But there's just so many barriers in the way that prevent midwifery care from being really accessible in the United States, and for midwives to be able to practice at the top of their license and reach as many people as possible. And one of the barriers to midwives being able to practice at the top of their license is all of the red tape in their ability to be licensed in their state to practice. It connects to laws that require some midwives to practice under a physician, like their physician is supervising their practice, or laws that inhibit transfers. Like, so if you are having your birth in a community setting at home or in a birth center, but need to be transferred to a clinic or to a hospital system, there are laws that prevent that. Midwives, a core part of their training is to be able to listen to their clients and their needs, and when they're concerned about something that they're feeling or something that might be happening in their body, like really listening to them, being attentive to those needs, and being able to assess when physician care is needed to address a problem that their client is having. That is core to their training. And so it is really important that policies help ensure that midwives can work with physicians, because a collaborative care model is really best when folks need higher levels of care. So midwifery care, again, has been seen to be just as safe or safer than physician care. And oftentimes it's policies that are getting in the way of being able to coordinate that care when folks need to be transferred.
That is awful.
Mhm.
Um,
It's so complex.
it is very complex, and it seems like it's designed to be complex, to be, like, disempowering,
Mhm.
to be like giving birth should not be in the hands of women or something, you know? And
Mhm.
it feels like the system is threatened by that kind of like community care model.
Yeah. Yeah, something you just mentioned made me think of how the medical model of care typically emphasize, like, the doctor is delivers the baby, where the midwifery model of care is much more like the mom is giving birth, and it really centers the mom, really harnessing the power that we have as women to give birth and really not jumping to interventions immediately. And so I will say that the midwifery model of care has shown to be a really affirming space for Black women in particular to give birth, especially when their care team looks like them. There's just a lot of research that shows that there's trust, increased trusted relationship when you have a physician or provider, or in this case, a midwife that looks like you and can really tend to your needs. And given the midwifery model of care and how they are trained to be more attentive and to listen is really important in the context of better understanding the Black maternal health crisis in the United States, because too often, Black women are not listened to. And so I would love to go into a little bit more detail about how Black women are experiencing pregnancy care in the United States and what that means for their health outcomes.
Please
Um,
do. Mhm.
Mhm. And I will start by saying that this problem is not new. It's baked into
Yeah.
the fabric of our American society and is come of our inequitable healthcare system and systems in general that are rooted in racism. And so Black moms are dying at much higher rates than their white counterparts. Latest data shows 3.5 times higher likelihood to die because of pregnancy related causes compared to their white counterparts. And I really want to emphasize that the problem is not Black women's race, but racism itself, because irrespective of education and income, Black women are still faring worse. And the belief that Black women have worse maternal health outcomes because of their diet, their genetics, their exercise is just false. It's not true. And in fact, Black women with higher educational attainment, higher income, fare worse than their white counterparts that have lower incomes and lower educational attainment, which is why it is so important that we still study the impact of racism on maternal health outcomes and do not default to using economic factors as a proxy for race, because we really need to be looking at racism itself. And then, not to belabor the point, but that is why you see folks like Serena Williams, Beyonce, Allison Felix come out and share about their birth experiences. And these are women that are really incredibly in shape, have access to all of the resources and presumably the support that they need to have a healthy pregnancy and childbirth, yet they are still not being listened to in the health within the healthcare system and still having really scary birth experiences. And so there's two points I'd like to emphasize, which is one, how racism shows up in our bodies, and then how it shows up within your relationship to the healthcare system and navigating care. So, one, There is a theory that was coined by Dr. Arlene Geronimus, who is a researcher at the University of Michigan, who I actually, when I was an undergrad, I was a research assistant within her lab. And at that time, I would never have known that her research would be such a through line in all of my professional experience. But her research talks about how the experiences of racism in your everyday, whether it's experienced firsthand or through seeing it and hearing it from others, slowly chips away at your health at a psychological level and a physiological level. So, a cellular level, increasing your risk of health concerns with time. So, in short, like your body keeps score. Like your body remembers the trauma and wears and tears over time. And then two, racism shows up in the healthcare system when you're navigating care. I'm sure you've seen some viral videos like on TikTok and social media about Black women being denied care when they've gone into like the emergency room or in a hospital setting because they think like they know that something's clearly wrong with their pregnancy or they're ready to go into or they're actively in labor. But oftentimes Black women are just not listened to. And when that happens, care is often delayed or inappropriate care is provided, and it can lead to morbidity and mortality, which is part of what is seen as preventable. So yeah, that it's a lot. There is a lot there, and this is just scratching the surface, really. Yeah, I would love to hear your responses.
That is, it's the, I have never heard that before, that the effects of
Mhm.
racism over time slowly chip away at your very, like, being alive and healthy. That is devastating.
You could just imagine, like, if you are and this is something that a lot of people go through, but if you're just navigating your everyday life, like trying to put food on the table for your family, but you're working a job that doesn't have very family supportive workplace policies, so you're stretched thin financially. Maybe you're living in an environment that doesn't feel safe for you and your family. You're managing other caregiving responsibilities. Like there's just a lot happening in our everyday lives. And then when you add onto that interpersonal racism you might be experiencing in your day to day, and then structural racism that you're navigating. And for example, like if you're trying to get like your WIC benefits, like all of the hurdles to even just obtain your WIC benefits are structurally, intentionally in place to make it really difficult for folks that really need that additional support to get it. And all of that is very, very taxing. Like that stress will wear on you over time. And yeah, shows up as weathering. Like it's weathering away slowly at your body.
So that puts Black women more at risk of having any number of health
Yeah.
problems.
And I would see it as, I guess, looking at some of the reasons why Black moms are dying more often because of pregnancy related causes. One of those reasons is inequitable access to the social drivers of health. So you can think of unstable housing, lack of access to healthy, affordable foods, unsafe environments, like the quality of schools in your area, environmental pollutants, like all of those things impact your health and also make Black women more likely to have health conditions before they are pregnant, like pre-existing conditions before they are pregnant, that if not addressed and being monitored by a healthcare professional can put you at greater risk for pregnancy complications. And so that's why it's important that Black women also have access to quality healthcare before, during, and after their pregnancy. So they're as healthy as they can be before they're pregnant. They can obtain the care while they're pregnant, and then they can receive that postpartum care so they can get their mental health care needs addressed and attend to anything that might have gone wrong during their childbirth, that they're seeking that proper follow-up care. So it is all very much connected, and racism is that common denominator that makes it really
Yeah.
difficult.
And racism is it's the air we breathe. It's the water that you're swimming in.
Yeah, there's a lot there. And I think the way the national partnership thinks about it is in a couple different ways. One is, of course, we still want to push for access to the midwifery model of care because of the outcomes that we've seen that it has for Black women. But we also know that we have a responsibility to hold the existing healthcare system accountable as well, because not everybody has, well, one, not everybody wants to give birth outside of a hospital. Like some people prefer that for different reasons. And then also sometimes having a midwife attend your birth isn't accessible for, as you mentioned, maybe you're a high risk pregnancy and that is not an option. And for those reasons, at the National Partnership, we're all about just informing people their options and doing our best to ensure that they can fully follow through on exercising any of those options that they desire. So if you want to give birth in a hospital, you should be able to receive high quality maternity care that is affirming, just as much as if you decide to give birth in your home. Like anybody should be able to have that positive birth experience. And that is actually personal to me because the way I was brought into this world was my mom had a high risk pregnancy. Like having her birth in a birth center or in a home setting was just not an option and not feasible. She had the emergency C-section. She had signs of preeclampsia where she was bed rest for like 8 weeks before giving birth. So like it's hard to hear, but it's also a really common story that a lot of women, a lot of Black women experience. And I'm just so grateful that both her and I came out healthy, and grateful that she was able to receive that high intense, high quality care where she did feel like her doctors were really listening. And it's a testament that can be like that can be possible. And so we want all women, again, no matter how they choose to get to do their birth, they have that safe, healthy, affirming option.
Right. We have to know and stick strongly to the fact that it's doable, the deaths are preventable. Doesn't have to be the way it is. We don't
Mhm.
have to just accept this and
Yeah.
like move along. Yeah. My pregnancy
Mhm.
was super high risk. I
Mhm.
had twins. Um So
Yeah.
I had an emergency C-section,
Mhm.
and at the point there just being, it can be so disempowering. I mean, obviously that medical intervention was needed, but, there was no other support in place
Mhm.
to, like, tell me that I wasn't a failure and, like, "No, you didn't do anything wrong," and yes, you're leaving the hospital without your babies, but that doesn't mean that it doesn't mean anything. It doesn't mean anything about you.
Mhm.
And that support was not there at all. And that is why like follow-up care is so important. And of course, I was scared to say anything about like mental health because I thought like they're gonna come like take my babies away or something. I mean,
Mhm.
and all I had was that like 6-week, follow-up with my OBGYN, and she just looked at my scar and was just like, okay.
Mhm. Mhm. Yeah, I appreciate you sharing that because we need to hear folks' childbirth and pregnancy experiences, because you are not alone. It is so common to have the feelings that you had immediately after giving birth and not be able to take your babies home, and the lack of postpartum support is really universal in a really terrible way. There's also, so at the National Partnership, we have this national survey that we do every couple of years called Listening to Mothers, where we survey, I think this survey, we have 3,800 people who completed the survey to share about their pregnancy and childbirth experiences, including that postpartum period. And it follows then, it's a two-part survey. So we are intentionally wanting to learn about that postpartum period as well. And the first report of several of our latest survey is actually being released in June 9th. And so we, especially right now, when we are, when access to maternal health data is becoming more and more difficult, we are all about amplifying the stories and voices of perspectives of moms themselves, because you truly know best, and sharing those experiences is the start to building community and raising awareness, because it's so often that people have to hold their stories close to them, whether it's because they're protecting themselves or there's not an outlet. But that is something we care deeply about at the National Partnership, and want to do all of our work in partnership with moms. And so just appreciate you sharing that story with me, because it needs to be heard and told. Yeah.
Yes. Yeah, it's I completely agree, because there's an element of shame, right? That should not exist, but, there's some element of shame, like it's your fault, like you failed, like if you can't breastfeed,
And
then
I was
you're not a mom. I mean,
Mhm. I that's immediately what I thought of, and I'm always, like, the first to be like, "I was a formula baby, and I am okay." Like, my mom could not breastfeed, and even sometimes you just don't want to, it's really hard, and I think the maternal health community also needs to be accountable for our messaging. Like, I will
Yes.
also say, I think part of it is this emphasis on infant health. I think when you see and view women as like a vessel to producing a healthy baby, there's a lot of pressure put on moms to do that when a lot of things are out of their control, and it's a mismatch. It's not properly applied there. And then two, I think the messaging from public health community and the maternal health advocates can be very punitive at times, especially around messaging with breastfeeding, or you see it oftentimes with safe sleep. And we don't always think about the cultural influences that impact how people want to raise their babies and their families, and it can really make people feel like there's only one way to do things, and if you don't do it or you can't do it, then you're a problem, and it's not helpful.
Absolutely.
Mhm.
Absolutely. And then it's like a cycle because the more you feel shame or guilt or like you're wrong as a mom, the worse parent you're going to be because you're feeling like shit.
Mm.
Mother's mental health is so important. And it's like it's counterintuitive to not take care of the mother and treat them like a cow.
Mhm, mhm. Yeah, and the mental health piece, it can be overlooked sometimes, because in the postpartum period where most of the maternal deaths occur, mental health is a leading cause, like the leading underlying cause for maternal mortality in the United States, and that is of suicide, and it's because of substance use disorder and overdoses. And so it's really, one, important that people have access to care that is not punitive. If you have a substance use disorder, that is an illness, and it should be treated as such. because often the punitive exacerbate the issue and tear families apart. And then on the other end, access to maternal or mental health care is, I've heard from working in this area that sometimes providers are hesitant to screen for certain mental health conditions because they don't know where they'd then be able to refer their patients to care. So they might be hesitant to screen for depression because then they don't know where they would refer their patients if they screen positive. And that, yeah, I can see your mouth almost drop. It's a challenge because there's folks feel like there's not enough resources or the resources don't exist, so there's hesitancy to screen. And then sometimes, since the healthcare system, like our mental health care, is so separate from the physical healthcare system, that the mental health side is like, well, this is a maternal health problem, and then the maternal health providers are like, well, we don't do mental health, that's a mental health problem. And so there needs to be more cross training so providers on either side can have that conversation with their patients, as well as increase knowledge shared with providers so they can properly screen and refer folks to care. Yeah.
There's a fundamental mistrust of what people are going to do with your health information, I guess.
100%. And this is making me think of the earlier parts of our conversation where we discussed how people sometimes think everything about pregnancy and childbirth is this positive experience. I think there's definitely a societal pressure that comes after having a baby that you should be happy, you have this
Yes.
baby. And it makes it that much harder to share with folks how you're really doing. And then there's also just this overemphasis on the new life itself. Like everybody's trying, it's so important to check in on mom. Like, how are you doing? How are you recovering? How does your body feel? What's going on in your mind? What do you need? And I think that can be definitely overlooked. Yeah, once mom and baby come home.
100%. It's overlooked. It's like once the baby is out, like you don't matter anymore. And that's just so counterintuitive because I still have to be a mom. I'm a
Mhm.
mom. I have to be a parent now. So, yeah, like the baby is healthy and the baby is going to do well if I'm doing well.
Mhm. Mhm. And something that we didn't talk too much about that I do want to bring up is doulas and the role that they play. And often midwives and doulas can be confused, but doulas are non-clinical, they're not medical professionals, they're peer support, and they assist pregnant people before, during, and then even sometimes after their pregnancy. Like postpartum doula work is so important in helping to fill the gap of social support and connection to resources that often exists in that fourth trimester. And so doulas are really helpful in providing informational support about what to expect during your pregnancy, during childbirth, but also after and during the recovery process, because giving birth is not an easy thing, and it definitely is not if you also potentially just gone through a surgery, through a C-section.
Mm.
But they also doulas are there to play an advocacy role in really speaking up for you and what you need and helping you, like coaching you through being able to identify what you need and voice that, and then also providing practical support. So some postpartum doulas will help coordinate the meal train, like who in your family, who in your social network is going to cook for you on Monday, who's going to do it on Tuesday, Wednesday, helping run errands, clean up the house, like all of those little things that add undue stress on new moms is a role that doulas can really play, along with that emotional support. And we've seen time and time again that being really helpful for all birthing people, but really helpful for Black women.
I imagine.
Yeah. And the last thing I'll mention about the postpartum period, and I'd be remiss to mention it because this is a huge aspect of the National Partnership's work on another one of our teams, is the need for paid leave. Like we need yeah, we need to have to enable women to really take that time after childbirth to recover and tend to their newborn. Like that is a full-time job, and it is unacceptable for women to shortly after giving birth feel like they have to go back to work because they need to. They need the funds to put food on their table, to pay the rent, to pay the electricity bill, and it's just really an inhumane way of going about it because in some other countries, people get months and months, half a year or more off, really be able to have up to a year postpartum of rest, care, being able to tend to their newborn. And that is a huge gap within the US system.
It is horrifyingly incorrect for people to expect women to, or birthing people to, in any way bounce back. Like you don't, there's no bouncing back. You are forever, you're different human. You're forever changed. Your brain changes to like take in all of this new information,
Mhm.
to like care for this baby like it is literally it's yourself. Like your identity includes the baby. You're a different human, and that is incredibly profound. It's The process is called matrescence, as I'm sure but it is, I didn't learn about it until it was, like, happening
Mhm.
to me.
Yeah.
No one told me about it, and I just, if the world or the country, if we were more informed about just the enormous mental and physical changes that women go through, that would make a difference in how we welcome them
Mhm.
back into work, into whatever.
Yeah, I think there's reoccurring trends on social media of how your body changes during pregnancy, and saw ones like your teeth change, your bones move, like things that people don't think about. Like your body, mind, and body have gone through a tremendous transformation through that process. And you're absolutely right that it's definitely overlooked and taken for granted. Well, I would love to share like some of the ways in which the national partnership thinks about what Black families need to really thrive. And I think for one, we gotta go beyond the data. There's a lot of data out there. We have to keep listening to Black women's stories and listening to them and truly holding ourselves responsible to addressing those issues and concerns because they are the closest to the problem and really are closest to the solutions. And then also thinking about the support that is needed, not just during the perinatal period, but really across the lifespan. It's because during pregnancy, respectful maternity care is huge. Like being able to receive care where you feel respected, heard, listened to, you're not experiencing bias or discrimination or neglect, that the care is culturally competent and congruent with your needs and your values and is an affirming birth experience where you are a part of shared decision making about your birth plan and how you want to give birth, where and with who. And then being able to have policies and support of those goals that where women can, no matter what options they choose, have safe and healthy and affirming birth is number one. So we're often working to expand access to the midwifery model of care and birth centers and doulas. But then we also are thinking a lot about beyond pregnancy care. So our reproductive health and rights team is really focused on ensuring that all women, especially Black women, have the freedom to choose if and when and how they want to grow their families. It is really clear in the evidence that women who are living in states with more restrictive access to abortion have worse health outcomes on average compared to states with greater access to abortion. So there is a clear connection there. And then as well as being able to ensure that Black families can truly thrive. So they have access again to those social drivers of health. They're in safe environments, they are able to get the right food, have good transportation, not living in a polluted environment, all the things that really go into ensuring that people are as healthy as possible. So that is how we think of it as the national partnership and what we're really pushing for, as well as in thinking about the postpartum support and the mental health care support. So there's a lot that can be done. And again, given that 90% of these deaths are preventable, even though that is a jarring statistic, it is what gets me up in the morning and helps me continue doing this work because progress can be made. Like it is we are failing our mothers right now and our Black moms in particular in the US, and the data is showing that that should not be the case, and so that is what motivates me during Black Maternal Health Week, but all of this 364 day or all the days outside of Black Maternal Health Week. Yeah.
Right. That's
Mhm,
wow. We are failing our mothers right now. We're
mhm.
failing our Black mothers. That's very powerful. That's a very powerful statement.
Yeah, and it hurts more when it's we've been saying these statistics for years. Like, I was in school studying this, and we're saying the same statistics and it's only getting worse and for Black moms in particular. And so it feels like we know that this is a problem. Why aren't we doing anything? And that's what makes it um, extra challenging in this moment and in the time we're living in right now, where Medicaid at the federal level has been cut. There's significant ripple down effects of how that's impacting states and families on the ground and their ability to access care. And so it feels, in particular in this moment, an extremely hard time to be working on this issue, but it makes it ever the more important to be focusing on it at this time.
You can't, right? Yes. You cannot stop. You
Mhm.
cannot stop. There's an I have an Angela Davis quote
Mm.
that is relevant. If I could say it correctly. Um, it's to paraphrase it, it's you must wake up every morning and believe that you can change the world or you
Mhm.
can have it. I'm paraphrasing it, but
I
it is
know the quote.
that.
Mhm.
Okay.
Yes, yes, you have to believe, yes. And it's I just got chills. I'm like, it's it's beautiful that we were able to start and end with her words.
Yes.
Yeah, so I really appreciate this conversation. And it's conversations like these that do give me energy because not every day is easy to do the work, but I appreciate you taking the time to learn more and to give Black maternal health another platform.
Of course. I mean, this is the reason why. This is the reason why.
Mhm.
So thank you. Thank you. And keep being amazing.
Thank you. I appreciate it.